So my name is Gwen Wagner. I am a nurse practitioner at Health Partnership Clinic, and I work in the Diabetes Focus Clinic. Health Partnership Clinic has a diabetes clinic which focuses primarily on diabetes and provides comprehensive care for those patients. Typically, it's for individuals who are having difficulty managing their diabetes, who perhaps have an A1C of greater than 9, for example. An A1C, the goal from the American Diabetes Association is that your A1C should be less than 7. So if it's over 9 and your primary care provider feels that it's appropriate, we get referrals to the clinic where we have these appointments that just focus on your diabetes and provide comprehensive care. When you have an appointment with the diabetes clinic, it is different than a regular appointment because we're just focused on that one thing. And so it's not your basic primary care where you might be doing multiple things or preventative care. We're just focused on diabetes and how to help individuals get better control of their blood sugars and their diabetes. And so we have 4 members on the team. We have a medical assistant, a diabetes coordinator, myself as the provider, and a behavioral health clinician. And we all work together to provide patients with the education, the medications, the assistance, and the counseling that they need to really get a hold of their diabetes and make improvements in their care. And so we have as a provider, I will look at what medications might need to be added or can be tweaked, also provide education about lifestyle and diet. And then we, of course, do physical exams and do the appropriate lab testing and other testing to be on the watch for those complications that can occur with diabetes. Our diabetes coordinator is really great at just setting up appointments, making phone calls, following up with patients who have had changes to their treatment plan, maybe are starting a new medication or changing their insulin, and she'll follow up with them to see how they're doing. She also provides education and goes over the treatment plan with the patient at each visit. And this is really helpful for patients. And she's bilingual, so she can serve many of our patients. And then we also have the behavioral health clinician, and he's able to help address barriers when they are present. So there can often be barriers to managing a chronic disease. There's other stresses in life. There's financial stresses that provide transportation problems with accessing healthy foods or medications. Plus there can be mental health issues such as depression, which impair someone's ability to really help control their diabetes. So he helps us address those. So the whole team is focused on really helping individuals help themselves and improve their health and their care of their diabetes. Fortunately, we have some various programs that can help us get patients with the medications they need, because diabetes medications are really expensive, especially the newer ones. So we're able to help patients through prescription assistance plans that the drug companies put out. There's also a pharmacy discount program that Health Partnership Clinic has, where we're able to get some of the newer medications at a discount price that makes it affordable for patients, particularly those without insurance or with insurance that has very limited drug coverage. And then we also have a limited supply of insulin for eligible patients that we're able to provide if that is needed as well. So we've had some really good success stories from the diabetes clinic that encourage us, and it's really patients learning to take care of themselves and empowering them to really take control of their diabetes. We've seen this happen through, I know there's a patient I'm thinking of right now who had an A1C of over 14, which is really high, and he adjusted his diet and mainly decreased his soda intake, and he got his A1C down to 7. He was on a couple of medications, but it was really cutting out that soda intake that made the difference. And I always tell the patients that if they can reduce their soda intake, that's better than any medication I can give them. We've also had patients who just didn't have access to the right medications, and just by simply being able to provide them with some medications that were out of reach financially for them, we've been able to get better control of their diabetes. And so I think it all works together, the education, the financial support, looking at barriers, everything that the team does just helps enable the patient have success. And so we've been able to do that, fortunately, in some cases. And, diabetes is a chronic disease, and so patients will reach their goal and then they'll fall back and their A1C will rise. We're happy to see them again and work at them because it's a lifelong illness, and patients have to continually work at it. So our goal is really just to help patients help themselves, that when they're in a slump, to help them get back on track, to provide them with the tools to enable them to be the healthiest they can, because if they take care of their diabetes today, then that's going to be much better for them in the future, and it's going to give them a much healthier future as they avoid those complications that can come from diabetes when it's uncontrolled. So that's our goal for our patients. Patients are typically referred to the high-risk diabetes clinic from their primary care provider. So they will have someone that they already see at Health Partnership Clinic, and if they have difficulty getting their A1C under control or it's over 9, then their primary care provider will refer them to the diabetes clinic to be seen.